It is a major renovation project underway for 3 of San Francisco's neighborhood health clinics. It won't be cheap, but health officials tell KPIX 5's John Ramos when the work is done, the entire city will feel the benefits.
In 2016, San Francisco overwhelmingly approved Measure A to improve health services in the city. Today, 3 years later, we got a chance to see where some of that money is going. For 50 years, the Maxine Hall Health Center in San Francisco's Western Addition has treated mostly low-income people with no private insurance. But in November, this clinic and 2 others began the rare process of renovation.
It does not happen all that often in San Francisco. This is a major investment by the city. It's about $63 million in total, and many of these sites have not been renovated for years and years.
At Maxine Hall, the building will be seismically strengthened, and cramped exam rooms will be reconfigured and made more accessible. And because it only has stairs, the clinic cannot use the second floor for patient care. The addition of a new elevator will mean 7 new treatment rooms.
It's due for a total rehaul.
Anna Robert, the city's director of primary care, says the same thing is happening at the Castro Mission Health Center. And at the Southeast Health Center in Bayview Hunters Point, a new 2-story addition will be constructed in the adjoining parking lot. Robert says it's vital to be able to offer both medical and mental health services in the neighborhoods where low-income residents live. Timothy Madison says having a clinic nearby has been an incentive to take better care of his health.
Like, why wouldn't I want to take care of myself when you have a clinic right in the neighborhood? Yeah, it beats getting on a bus or having to drive somewhere.
And while the cost of the renovations isn't cheap, Robert says the entire community ends up paying an even higher price when its poorer people don't have effective health care.
They're in the hospital, they can't work. I mean, the effects on it's just a compounding problem if we don't do a good job.
They say the renovations will allow them to do an even better job of keeping residents healthy, fulfilling the promise made to voters 3 years ago. In San Francisco, John Ramos, KPIX 5.
The Bayview Hunters Point Clinic will stay open while the new building is constructed. The other 2 centers have been relocated to temporary locations, and all 3 projects are scheduled to be completed within 2 years' time.